Good day, ladies and gentlemen. I am Crystal Espada, and before we proceed with the case study, let me share a brief introduction of the highlight of this day, which is the potassium electrolyte. Potassium is an electrolyte which can be sourced from various fruits and vegetables, such as cucumber, potato, banana, orange, and apricots. Having an enough amount of potassium in the body is crucial for processes such as transmission of nerve impulses. The concentration by active transport of this electrolyte is unessential. When it enters the cell, it instigates the electrical potential that allow the conduct of nerve impulses. In relation to these nerve impulses is the need of potassium for smooth and skeletal muscle contractions. It is involved in the electrical signals sent by muscles to contract properly and for regulated heartbeat. Another is in the regulation of metabolic activities, which include carbohydrate metabolism, glucose and glycogen metabolism to be stored in the liver for future energy source, and in the balancing of body fluid, wherein the intake of this can help reduce water retention by increasing urine production and reducing sodium levels. That is all, and we can now proceed to the study.
Hi, I am Heart Angel and I will be the one to present the patient assessment. The patient is a female senior citizen aging 68 years old. She had complained of having weaknesses of her extremities for 12 hours, but no other symptoms were presented relating to cranial nerve involvement, raised intracranial tension, and autonomic dysfunction. Her past medical record states that she had a coronary artery disease, specifically a condition wherein the anterior myocardial tissue, usually supplied by the left arterial ascending coronary artery, suffers injury to lack of blood supply with moderate left ventricle dysfunction. A weakening of the heart caused by the disturbance in the relaxation process of the heart, which made the left ventricle stiffer than normal. In addition, she had undergone percutaneous transluminal coronary angioplasty. This procedure was done for opening the blocked coronary arteries to improve the blood flow to the heart muscle. She had been taking aspirin, ramipril, and spironolactone within the past few years. After the examination, it revealed hypotonia on all four limbs with a power of grade 2 and absence of deep tendon reflexes. Other examinations turned out normal.
Let's continue with the cause of condition. The symptoms of the patient are likely to be caused by the abnormal amounts of potassium, an electrolyte stored in cells or excreted in the urine and stool. The high amount of potassium, known as hyperkalemia, is a risk since it has reached the higher levels, which resulted to the symptoms stated. This abnormal amount affects heart and skeletal muscle function by lowering the cell resting action potential and preventing repolarization, thus the decreased muscle tone. Along with muscle weakness, another symptom of this condition is depressed or absent deep tendon reflexes, which have been observed from the examination of the patient. However, this is caused by a decreased excretion of potassium in the kidneys. The kidneys are evidently not functioning well, as presented by the high amounts of creatinine and also a high amount of blood urea during the examination. A kidney which cannot function properly can no longer remove excess potassium, which led to the accumulation of the electrolyte in the body. There have been no recorded abnormalities in the kidneys of the patient in her medical history, but various factors may have led to this damage in her organ. A known factor of kidney failure is by the intake of drugs. From the patient's history, she had been taking aspirin, ramipril, and spironolactone within the past year. Aspirin, a non-steroidal anti-inflammatory drug, which she takes 75 milligrams daily for over a year, reduces renal function, since NSAIDs are known to decrease the filtering of potassium in the kidneys. Another drug that the patient takes is ramipril, an ACE inhibitor used for high blood pressure and heart failure. It has been recorded that the consumption of ACE inhibitors for a long period of time can affect the proper functioning of the kidney. Lastly is spironolactone, a drug for preventing the body to absorb too much salt. This reduces the body's elimination of potassium, causing blood potassium to rise, and also an evidence is the low sodium level of the patient in her laboratory results.
Hi, I am Ned Capili, and I'll be the one who will present the diagnostic test and results of the patient. After a thorough examination of the patient, abnormalities rooted from malfunction of the kidney were detected. The hemoglobin, blood urea, serum creatinine, serum sodium, and serum potassium of the patient are in irregular condition. The 10.3 grams per deciliter result of the patient's in hemoglobin level is too low compared to the normal, which is 14 to 16 grams per deciliter. Thus, this may lead to her being anemic. In addition, the blood urea of the patient is 54 milligrams per deciliter, was found to be higher than the normal range of 17 to 48 milligrams per deciliter in the human body, which is result if the kidney is not able to eliminate the urea from the blood in a irregular manner. In the results given about the serum creatinine of the patient, it was found that she was an excessive amount of serum creatinine in her body, with the result of 2.6 milligrams per deciliter from the normal range, which is 0.8 to 1.2 milligrams per deciliter. The same with blood urea. This buildup of serum creatinine is also caused by malfunction of the kidney. Furthermore, the low 134 milliequivalent per liter from a normal level of serum sodium, which is 135 to 145 milliequivalent per liter, possessed another threat to the health of the patient. Finally, the serum potassium results has also showed a far different from the normal range of 3.5 to 5 milliequivalent per liter by showing an amount of 9.4 milliequivalent per liter. However, the remaining results obtained from the examination were normal.
For the medication implication part, the patient presented with weakness of her extremities for the past 12 hours. Upon checking the patient's medical records, it was found out that she had a past disease in her heart and had a surgical procedure to treat her condition, and has been taking aspirin, ramipril, and spironolactone. These medications, taken by the patient for the past year, have significantly affected the function of the kidneys not to excrete potassium ions, which led to high potassium levels in the patient's blood, also known as hyperkalemia. Aside from the evident weakness in the patient's extremities, it has also been noted that during the medical examination, the patient presented with grade 2 limb power and absence of deep tendon reflexes, which confirms that high potassium levels have been the cause of these symptoms. Proper interventions such as prescribing medications, health education, and proper assistance to the patient will be utilized to address the patient's condition.
Hello, my name is Jasmine Alfredo and I'm going to discuss the drug therapy of our case study. Basing from observations of the patient's assessments, the main goal of the pharmacotherapy is to assist in minimizing the potassium levels of the patient, decrease morbidity, and avoid worse scenarios caused by the present condition, the pace with which hyperkalemia has occurred, the absolute amount of blood potassium, and the indications of toxicity all influence how aggressively hyperkalemia is treated. The faster the potassium level rises, the higher it has risen, and the more evidence of cardiotoxicity there is, the more vigorous the treatment should be. If the patient's potassium level is only moderately elevated and there are no ECG abnormalities, excretion can be raised with a cation exchange, resin, or diuretics, and the source of excess potassium. For the case of the patient, to preserve cardiomyocytes, calcium gluconate should be administered as a first-line treatment in the individual since the patient has hyperkalemia. The combination of insulin and glucose is the quickest acting drug therapy for moving potassium into the cells. In addition to insulin, B agonists can be administered to lower potassium levels in the blood. Calcium protects the myocardium from the hyperkalemia's damaging effects. It also lowers the risk of ventricular fibrillation induced by hyperkalemia. Beta-adrenergic drugs, insulin, and loop diuretics increase cellular potassium absorption, which lowers blood potassium levels. Insulin in combination with glucose facilitates glucose absorption into the cell, resulting in a potassium shift intracellularly. Hyperkalemia is potentially life-threatening if there are characteristic electrocardiographic abnormalities or a fast rise in blood potassium. The initial step in diagnosing the etiology of hyperkalemia and directing long-term treatment is to gather urine, potassium, creatinine, and osmolarity. Intravenous calcium reduces the likelihood of arrhythmias and reverses electrocardiographic abnormalities, but it does not lower blood potassium. Intravenous insulin and glucose nebulized beta-2 agonist or both can be used to reduce serum potassium levels quickly. To reduce total body potassium levels, sodium polystyrene treatment is started occasionally if intravenous furosemide and saline.
For the management of the condition, aside from taking medicine, a change in the patient lifestyle and diet is also recommended. She must reduce her potassium intake as long as her potassium levels are still high. The food that she must avoid include bananas, nuts, beans, milk, potatoes, and apricots. Salt substitutes and food with many additives are also not an exemption. A regular amount of water in the body is also a beneficial way of managing high potassium levels and also prevent kidney stones. Lastly, an exercise routine is another generous act because it promotes bone strength and health. For the principal correlation, it will be presented by Ms. Cabasan.
Hi, I am Blessed Rose P. Cabasan, and I will be the one presenting principal correlation. For principal correlation, we have potassium. Potassium is an alkali metal element found in period 4 of the periodic table. Potassium atoms have 19 electrons and 19 protons with 1 valence electron in the outer shell of the atomic weight of 39.10. It is also considered chemically similar to sodium, another alkali metal above it on the periodic table. Potassium metal is soft and white with a silvery luster, has a low melting point, and is a good conductor of heat and electricity. Potassium imparts a lavender color to a flame, and its vapor is green. It is the seventh most abundant element in Earth's crust, constituting 2.6% of its mass. It also has a very low density and is the second least dense metal after lithium. It is so light that it can float in water. Chemically, potassium is a very active metal. It reacts very rapidly with water to form a colorless potassium hydroxide and hydrogen gas solution. The resulting solution is basic because of the dissolved hydroxide. The reaction is exothermic. It also reacts with many other elements and substances such as oxygen, acids, sulfur, fluorine, and nitrogen. 3 isotopes of potassium occur naturally: the potassium-39, 40, and 41. The majority, 93% of potassium found in nature is potassium-39. It is an electrolyte that counteracts the effect of sodium, helping to maintain consistent blood pressure. It is also essential for maintaining the balance of acids and bases in the body. Potassium is the major intercellular cation, with 98% of the total pool being located in the cells of a concentration of 140 to 150 millimoles per liter, and only 2% in the extracellular fluid, where it ranges between 3.5 and 5 millimoles per liter. A fine regulation of the intercellular-extracellular gradient is crucial for life, as it is the main determinant of membrane voltage. In fact, acute changes of potassium plasma levels may have fatal consequences like hyperkalemia. Hyperkalemia is a potential life-threatening electrolyte imbalance. This condition may result from the disruption of the equilibrium between the intercellular fluid and extracellular fluid concentrations, or from an increased total body content caused by excessive food intake or defective excretion. The resulting increased plasma potassium leads to a partial membrane depolarization that may eventually cause cardioplegia and skeletal muscle paralysis. That's all, and thank you for listening.